so taking advantage of that, that is where I was able to get my feet wet into the real trenches and understanding of what's going on in the front office, what's going on in the back office, what's the sterilization protocols.
Hey everyone, welcome to the Dental Office Managers Community Podcast, where we talk about the issues that matter most and help us to become better leaders in our dental practice. I'm your host, Kyle Summerford. Let's dive right in. Hey guys, it's Kyle, and welcome back to another episode of the Dental Office Managers Community Podcast. And today we have a special guest, Jonathan from Talent by ZIA. Jonathan, thanks so much for joining us today.
Thank you, Kyle. So happy to be here, and thank you for the opportunity.
Yeah. So, I wanted to bring you on here because we met at the SCN meeting, and we had a brief discussion about what your company does for dental practices. And I thought it was really interesting, and I thought it would be just a really good idea to bring you on here. That way we can kind of showcase the talent by ZIA, which I love the name, by the way.
Thank
Um,
you.
and actually, how did you come up with that name?
Yeah, so Zia is actually homage to our late Rottweiler. She was going to be turning 15 on May 7th, and unfortunately, she was 2 weeks shy from meeting that day. But Zia in Swahili means to be in motion, and there's a lot more other like really positive affirmations that come into play, like tranquility, calmness, completeness as well. So kind of falling all of that into staying in motion, that's really where we kind of created the concept of talent in motion, and that is Talent by Zia.
Ah, okay. Okay, cool. Yeah, I love the name. When I heard it, I was like, that's such a cool name. So anyway,
Thank
thanks
you.
for kind of running through that. So yeah, Jonathan, why don't you share a little bit of your background and how you made your way into dentistry?
Yeah, absolutely. So my background's kind of funny because I started off in more of the pharmaceutical world in healthcare. I initially had a roadmap and plan when I was in high school to become a plastic surgeon, went through all of the prerequisites and accreditations that I could do at that time in my education career. And it wasn't until I became a certified nursing assistant that I realized the clinical side of healthcare was not for me whatsoever. Couldn't handle the blood, couldn't handle the odors. So I figured there's no way in hell I can do a rhinoplasty at any capacity. So decided to take a break from school before going into the corporate world of healthcare, where I worked with organizations like McKesson and CVS Health, really driving a lot more of the pharmaceutical advancements taking place with new products coming to market, new medications getting released and approved by the FDA. And I had a lot of fun doing it. I did it for several years inside of more of a people operations and implementation capacity. But it got to the point where I was still operating more in like a corporate call center environment. I wasn't in the call center space, but I was developing and launching those products. But it got to the point where I was ready to be back in the trenches with the people, meaning what's the difference and impact that we can be making today. And at that time, this was, I want to say, end of 2018. My husband, Michael Bonanno, he's also in dentistry. He used to own dental practices in Arizona. At that time, he had just sold his practices and launched his own consulting firm. And he recruited me into dentistry to build
Mhm.
out his operations in HR because that's my forte.
Yeah.
So about 6.5 years ago, I stepped into a consulting agency, operated as the COO, building out all of the operations and HR verticals, and immediately put on the practice management consultant hat. And as you could probably imagine, coming into the world of dentistry without a lick of dental experience, it can be quite intimidating.
Oh yeah.
But I just leaned into what I knew best, which was continuous improvement initiatives. So starting to find and point the holes and the gaps that were really present amongst the team, amongst the culture, amongst the leadership approaches. And I really just kind of finessed into what I knew best and really positioned myself into those conversations while still being a sponge because I inherited 65 plus team members at the time, but me as the quote unquote boss, which is just a title, how am I supposed to help develop a team member if I don't even know what they're experiencing from maybe the eligibility process in the
Right.
conversation? So while I was operating as the CEO of the agency, I actually dualed inside of operating as an office manager and transitions consultant for one of our clients. She came to me, she wanted more of my time, and we were trying to figure out, what's going to be the most not necessarily lucrative way, but the most advantageous way to get my level of learning that I was looking for and ensure our clients' experience was stellar. So I positioned it as, I'll come in and manage your practice 3 days a week and help you
Mm,
sell your practice by August of 2020 of all years.
cool.
I want you to help me understand and learn the ins and outs of dentistry. Sold. So it was a good year and a half of me managing a practice 3 days a week. I would go into the practice while also managing all of our other team members. And by day three, I was plugging away in Dentrix, cash, check, or credit. How would you like to
Mm,
pay for your full mouth
uh,
restoration? We were fully cosmetic, PPO driven for those patients that were seeing our associate, but we were also heavily fee for service. So
yeah.
it helped me understand a lot of the ins and outs of where the compensation, the money structures were going, and then of course learning how to best manage and direct the team. And that was just, that's an education that you don't necessarily get to pay for all the time. So when those type of opportunities show up, you take them.
Yeah. Yeah.
um, so taking advantage of that, that is where I was able to get my feet wet into the real trenches and understanding of what's going on in the front office, what's going on in the back office, what's the sterilization protocols, what are the CDT codes, understanding and getting into the real world of the fulfillment side, no matter the role that you played, was just very, very vital for me to be able to do what I'm doing now at the level that I'm able to do it because my scope is able to be a lot deeper.
Right. Yeah. 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 So you and I and many others that I've spoke with share a similar story in the sense of like how we got into dental. Um, and it's always kind of like, hey, it was somewhat accidental. But then I was thrown into the fire, you know,
No
and,
pun
and, uh,
intended, accidental.
yeah, 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 exactly. So it's always good to kind of connect with others that have a similar story like that, and then to see how how well that person has done. So and how they progressed in dental because there's so many opportunities in dental. I feel like if you start out in one area in an office, even dental assistants, I mean, you could be cross trained to the front desk, and you can kind of
Yeah,
work two separate positions. But yeah, I mean that's amazing. Your story is amazing, and I'm always intrigued and happy and glad to connect with others who have similar stories. So that's interesting, and thank you for sharing with us.
of course.
Now tell us a little bit about Talent by Zia.
Yeah, so we have been in this kind of same space that ZIA operates for a little over 7, 8 years now, which is really maximizing the ability of our talent and potential that they really bring to the table. So ZIA in itself is a talent agency. We operate in both the talent acquisition and optimization space for both virtual and on-site teams. So looking at ways not only to attract the appropriate profile, ensuring that they're culturally competent and capable to perform the skill or the function, we're also looking at the retention. What does the growth and development structure or strategy look like for that individual once they've been acquired and retained? Talent is the most expensive currency right now. We all are experiencing talent shortages in some way, shape, or
Oh
form, right?
yeah.
So how are you actually positioning your people in a way that can benefit some of those shortages currently while also giving them the tools and resources they can to grow as an individual contributor, then in turn become a leader in some capacity or facet of the practice? So being able to position ourselves more in like that integration and retention conversation, that really helps our foundation that we built on. I'm an industrial organizational psychologist, so I focus on the fundamental practices of workplace health, workplace behavior, and I'm a huge conduit for creating psychological safety. And that's really the starting point where myself and my team operate from is if we're not safe to share ideas and craft a conversation and be willing to not necessarily have a constructive debate or a heated debate, I should say. A constructive debate is the outcome that we're looking for.
Yeah.
We want to be able to see what really is that, what's the outcome we're desiring, what's the outcome we're intending for. So when we position ourselves and put on that framework or that lens, looking at what's the way of being that really needs to show up for that individual or for the team and the organization as a whole. So the position that we take on inside of that really is everything from the acquisition and the integration process. So whether you're looking for some of the most demanding positions right now in the market, looking for a dental assistant right now, it's not what it used to be a couple of years
No.
ago. I
Yeah.
could headhunt and post an ad, and I'll have a candidate within 2.5 weeks for a presentation to a client. Now that timeline is shifting from that 2.5 weeks to probably around 4.5 weeks was the last study that I did. And it's
Wow.
not for any other reason other than we're looking for the people that are bubbling to the top. Those that are rising to the
Mm,
surface are fewer and far between than those that are looking for complacency and flexibility within their current role. So bringing those tidbits into kind of our strategy and approach, it really is just being aware of what the market is doing. What's the
mm,
conversation? What's your region? It's it's funny because we'll get opportunities and we'll have clients coming to us and they'll be sharing, yeah, we need to hire a new associate and we've been looking for the last 6 months, we can't find anyone. And then they hire us and they're like, where are they after day one? I'm like, guys, we have to get in and understand the market. You have been doing this for the last 6 months and these are the results you've received.
yeah,
So we need to shift the type of direction and approach that we're using so we can change the results we're looking for.
I see.
So really taking on a more holistic model. There's a reason why we follow more of a talent acquisition approach because it is continuous. It's more strategic in a sense versus reactive and emotionally driven. We can be out in front of what we're trying to solve for versus trying to get a butt in the seat today.
Gotcha. So that's interesting. Yeah, and I've heard I see it all the time in the group where some offices are struggling and it's all over. It's, everyone is looking for a dental assistant or a hygienist or an associate, and it seems like, it's just difficult when you throw an ad up on Indeed and then you're spending all this money and you're either getting talent that you're not looking for, right?
Yeah.
Or you're just getting really no response at all or a bunch of no-shows. And I've experienced that in the past when we were looking for a hygienist in our practice. And so, it's a struggle right now. And I mean, that. So, so what exactly, like, what are the methods that you guys are using, or what is it different that you guys are doing as opposed to like an office just throwing up an ad on Indeed?
Yeah. So when it comes to the talent acquisition model, we will reference strategies from the recruitment stasis, and it's appropriate in terms of when you're looking to look for some of those immediate functions that we need, like front office positions, dental assisting roles, hygiene. Those are critical positions that can drive productivity in the practice. So when there's more of a void present, it just continues that void. So when we are coming on to support a client, we're starting to analyze, what's really the problem that they're looking to solve for. Is it the fact that they're needing a hygienist because they have all this outstanding hygiene recare? There's outstanding treatment plans for hygiene that need to get solved for. Okay, great. That's the issue that we're looking to dive into. Now let's really understand what's the strategy behind it. Are you looking for a hygienist or are you looking to maximize the potential of your existing hygienist? Because now it becomes a conversation of, do I need to add another hygiene individual to my team? Or do I need to find ways to maximize the hygiene potential within my department? So what does that look like from a virtual or on-site talent need? On-site talent need, we're making our analysis and recommendation based off of whatever goal that's really present. So we might say, yes, you do need to add another individual to your operatory. Let's make sure
Mm,
that we've outgrown, or not outgrown, but have maximized the potential of this single column. And now we're going into this direction so we can ensure that maybe we're adding Fridays on, or maybe want to add more opportunities for our patients to be seen, whatever the circumstance may be. Or on the flip side to that, it's now in the virtual conversation. If we're not maximizing the potential of our existing patient base, how can we assign or allocate some of those resources, or I would say mundane tasks, to somebody like a hygiene recare coordinator? That's somebody that can be in a virtual capacity, that's ensuring that all of your patients are being contacted. And then that's a position and action being taken forward.
I
So
see.
we take on the full complete lens of really understanding how is the talent strategy of the practice truly aligning to the business strategy, because there's a distinction when we put in like to versus with. If
Mm,
we operating from the space of with, we're already assuming that that's there, and we already know what happens when we assume. But if we change the context to, we're being intentional of the direction that we're looking to take. So we don't just operate like in the space of oh, you need a job or you're looking for people?
Right.
Yeah, we'll help you. We'll find it and we'll bubble them up to you as soon as we can. No, we're taking on more of a partnership approach because we know the issues, we know the challenges, and we want to help you and support you. And when you're ready to go into the virtual route, you have to be ready to understand, are you actually physically having conversations within your team? Is there alignment? Is there the level of engagement that's currently in place to support the new engagement of a virtual team member? Because what you
Mm,
don't see goes unnoticed, right? So if you're not
right.
constantly seeing or engaging with your virtual talent, now they're just there and they become
Right.
more of like a service provider versus an extended team member. They're just
I see.
geographically disconnected. So that's kind of a big picture, high level overview of the conversations that we'll have when we're going into more of like that partnership approach, because we don't just want to put butts in seats, because if we're starting to compartmentalize them, we can break it down by three different type of players. We have our A, B, and C players. Our C players are those individuals that we can spot in the interviews where, yeah, they can come, they're going to make a difference, but I know they're not going to be here for more than 6 to 9 months.
Hmm.
But I know I need somebody to come and make an impact today. Probably level 3, level C. But what's our B players that we're looking for? Our B players are the contributors that are contributing to the change in the practice or the organization. But if we were to lose them, it's not as big of a hit as A player would be, where your A players are like, shoot, how can I make sure that you stay? What can I do to make sure that you're getting the resource, getting the support, getting the acknowledgement, getting the rewards, the
Right.
bonuses, what have you, to ensure that the opportunity is the one that is still here today for you. So it goes deeper. There's a
Yeah.
reason why we like to really ground ourselves in that psych conversation is people are emotional. People are making a lot more emotionally driven conversations. And as a result of COVID and the pandemic, people are focusing on what's going to provide a level of passion versus the profitability in their day to day. So, are you actually making a difference? Are you making the impact you're looking for? Hygiene, associates, dental assistants, front office team members, they all have different walks of lives that brought them into our world of dentistry. But
Right.
what's the level of impact and how is that shifting? And I think there's not enough conversations there, which is where we emphasize and highlight to talk to your team. What do they want to do?
Mm,
How are they growing? How are you wanting them to grow? So succession planning, right?
right. Right.
Showing
Yeah.
that engagement and interest of your people.
So you guys are, I mean, it sounds like you guys are much more than just a job placement like agency. It sounds
Yeah.
like you guys really get down to like the nitty gritty, the like the psychological side of like, hey, you're analyzing every scenario, every person, every that's interesting because I've never seen that approach in the 22 years I've been in dental. I've never seen a company that actually takes on or even takes this type of approach to really find some help for a dental practice. But it sounds like you also offer, so besides positions in the office, do you guys? It kind of sounded like there was also some type of virtual side of this. Could you tell me
Yeah,
more?
Yeah, absolutely. So we'll do all aspects of the talent acquisition approach and models. So if we're working with an office, we work with a lot of emerging groups. So that's usually like that 3 to 8 practice model. And then we have a handful of DSOs where it's 25 plus locations that we support. So depending on the conversation that they're in is where we make the appropriate recommendation. Do we expand with on-site talent, or do we look at how we expand and centralize utilizing virtual talent?
I see.
So when there's a conversation of centralization or maximizing dollars and values, or maximizing EBITDA, we start looking at what can do that. And the way that we can start creating that is through really crafting our own people EBITDA strategy, which is what are the functions in the practice that are not producing or not of highest value to the patient experience or to the level of team engagement. And many of those areas, which we see profusely, is insurance verification, recare, patient confirmation calls, RCM, the whole world that brings into play, and then even credentialing. When those conversations and topics show up, it's a no-brainer to outsource those types of conversations to a virtual team member. There is a reason why we operate in the global talent acquisition space, is not only to bring new opportunities to different markets and different individuals, but we are touching and scraping the surface of a largely huge talent pool that we can benefit from. So the question becomes, if we're already dealing with a talent shortage, why are we resisting the ability to bring in virtual individuals that are ready to work, that are capable to do it, have the know-how, but might need a little bit of training,
Yeah.
right? So it becomes like what's really what the math isn't mathing,
Right.
right?
Right.
What is of
Yeah.
highest value? What are you wanting to
Yep.
truly prioritize? Is it the difference of having a full schedule, or is it ensuring that you have a good appearance in the practice? Both
Mm.
play a significant role, both contribute to the greater whole.
Right. Yeah. Wow. Okay. I mean, again, like, what you guys are doing seems like a lot more than what a typical agency will do or what a practice can do on their own. I mean, any dental practice could just throw up an ad. And I've seen it time and time again in the group where it's like, we're not getting responses. We're not getting, where are you finding these people as if they're like, holed up somewhere. So
Yeah,
it's struggles that the practices are facing and offices are suffering, because maybe they feel they need to add a new staff member or maybe they need to add an associate because they feel they're busy enough to that point where they need to add on someone else. But it sounds like you guys really kind of do an assessment and really say like, hey, look, is it reasonable or do you actually need this, right? um
right.
so so through the process of, let's say a company does move forward, and they say, "Hey, look, we need you to find a dental assistant for our practice." What does that process look like?
Yeah, so we will follow a very similar approach to dentistry does. As the patient's coming in, they're coming in for a new patient exam, they're getting their x-rays, they might be getting a diagnosis, and then potentially a treatment plan as they're walking out the door. We utilize that same approach in our language, in our conversation, because we don't want to be too crafty and say, "Oh, this is our like success wheel that we're going to walk you down," right? Like, no,
Yeah,
let's get on the table with what we're talking about here. And
right.
it's really formulating our treatment plan based on our diagnosis. So first stage is really conducting our exam. If we're going the virtual route and it might be more RCM or IV related, we're getting into your software. If you're Dentrix, Open Dental, whatever other platform that you're operating from, we're pulling the reports. We're wanting to know what is the environment looking like so we know where we're starting and we know where we can take you to. And then we can make our best recommendation in terms of, yeah, you really can benefit from having one virtual individual, or maybe you need 3 or 4 to tackle your AR because it's out of the water, right? Or if it is going more of that on-site approach, as you mentioned, where we're looking for a dental assistant, and it's been months where we haven't been able to find someone. We posted ads on End on Indeed, but nobody's hitting them. Well, a part of our exam inside of that approach is really conducting the research. So we're pulling a lot of the data from all the different job boards. I'm looking at the different and number of opportunities within a 25-mile radius, within a 15-mile radius, now within a 10-mile radius. Nobody wants to drive more than 30 to 45 minutes to work anymore.
Hmm.
So knowing that,
Unless you
we
live in
can,
New Jersey and you work in Manhattan.
there you
Sorry,
go. There you
sorry,
go.
but I had to put that in. You said it, and it resonated with me. So sorry, sorry.
Yeah, no, 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 but you're absolutely right, and it's all about the person, right? If they're willing
Yeah.
to do it and you're willing to allow them, awesome, great, wholeheartedly, bring them on. But how long is that going to last before that level of burnout
Yeah.
starts to come up?
Yep.
We all know it. We get aggravated in the car.
Yeah.
People have road rage even if you don't
Road
have
rage
it.
every day. Road rage.
Exactly,
Yeah.
exactly.
Yeah.
So when we're performing that initial exam, it's conducting and compiling as much data as we can find, scraping the different job boards, scraping the different ads that maybe the office specifically has posted, and then understanding the timeline. How long have you actually been looking for a person? What are those traits? What are the qualities? What does your ad currently look like too? And maybe that's the big issue inside of what you're attracting. What you're seeing is not in aligned with what you're looking for, or vice versa.
Mm.
So really taking that into account and understanding the practice philosophy, what they value, what does the team structure look like? What type of tools and resources are available in the practice? Are you championing CE? Are you championing any form of education? Are you helping individuals as a dental assistant promote into the world of an EFDA? Right? There's so many things that can show up inside of that context, but it's contextual. So when we're starting that research and exam approach, it's all of that. I need to get into the worlds of what is your practice looking like, because I'm supporting practices across the country. I'm not based in Texas as some of our clients. I'm here in San Diego. So my market is much different than yours, but the
Right.
conversation's the same. So how do I ensure that I'm finding the appropriate person that fits the need?
I see.
Great example, hitting a market and looking for a dental assistant, we're reaching out to upwards of over 800 candidates for a single position
Wow.
in the single metropolitan area, and we're getting 10 to 15 results and responses back to that. So it's not
Wow.
just a matter of posting the ad. The true art of recruiting right now and acquisition is headhunting. If you're not being out
Right.
in front and spending the time to engage, connect with your people, connect with potential talent, they're not going to just come and flock to you all the
Yeah.
time.
Yeah.
And if they are, you're probably one of many that they're just doom scrolling and saying, apply, 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 apply.
Right.
I can't tell you how many times I've had that same conversation this week. Oh, can you tell me what job that was again? I don't remember what I was applying to. Oh, that's a big flag of like, okay, well, maybe you're not the best talent for my team, but I'm going to
Yeah.
give you the benefit of the doubt and let's have a chat, right? Because I need you
Right.
too.
Yeah, 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 and that and you so you mentioned that, and again, like going back to what I said earlier with when we were looking for a hygienist, we noticed that it was like that. It was exactly like how you just said. So they call back and they'd respond and they're like, "Oh, I'm sorry, what job was this for?" And I'm like, "How many jobs did you apply to?" You're
Yeah.
just shopping around. It's like you're shopping around, kind of. It reminded me of like a patient that calls the office and they're like, "Hey, how much do you charge for an implant?" And it's
Yeah.
like,
Right.
"How many other offices did you call today?"
Yeah.
Yeah. So
Exactly.
so you guys, all right. So I mean, that's definitely something unique with you guys. Now, let me ask you a question. So if a candidate does get placed by Talent by Zia, and they get placed into an office, is there like some type of ongoing support that you guys provide throughout the process?
Yeah, so depending on the practice need, we'll have that conversation with them too. If they're looking for more of like a quarterly check-in or monthly check-in to have a talent strategies discussion, we'll have those conversations. And
Mm.
that's more specifically to on-site needs. So we'll be able to make sure that we're out in front, we're ensuring that we're providing the level of the talent that's needed, or it could just look like, hey, I might be hiring in the next 6 months. I don't need somebody now, but can you start filling the pipeline essentially? And then we start having our conversations. When
Got
it's
it.
more of a virtual talent conversation, we have monthly and weekly check-ins too with our clients, depending on their requests, to make sure that there's movement taking place. We want to
Yeah.
make sure that we're inspecting what's being expected and they're not just a team member going unnoticed. So when we're going in and having those conversations, it's really just maintaining the our partnership because we don't want to just be another person that we kind of not churn and burn, but kind of brought through the
Yeah.
finish line. And they're like, okay, thanks, let us know when you're
Yeah.
ready to hire again. No, it's like, all right, great. What's next for you? What's next for this individual? So that's where we focus on the optimization piece now, that retention and development component. We have a handful of virtual trainers. My head of learning and development and integrations manager is actually based in Brazil, and they're brilliant individuals. And they're the ones that jump in. They've crafted these beautifully structured concepts that will literally teach you the fundamentals of dentistry from zero knowledge up until an advanced intermediate skill set. So
Wow.
bringing that into play, we offer it like, hey, we know that you are having an issue with your front office administrator, and they could benefit from some TLC around patient conversion when they're on the phone. Well, we have a program that we can train them on, bring them into. Would you like that? Are you interested in that? And depending on the need, they could say, oh, yeah, sure. Let get them enrolled into the course, set up a couple sessions with whomever they need to talk to, or yeah, send it over. We'll take a glance at it. I'll see what I can use. And then I'll have another check in with her and I'll let you guys know what's working.
Got it.
So it's all about that level of collaboration because we don't just want to be we're not a service provider. That's the biggest
Yeah.
thing. We're
Yeah.
here to be a
Yeah.
partner for your success.
Yeah, you guys are providing support throughout the process, which is one of the struggles I have seen with other practices where they work with a placement agency or something like that, and then they just place them and they say, "Hey, pay us this fee," and
Yep.
then you know that's it. Thanks for the
Yep.
money. Goodbye.
Yep.
And so it's a breath of fresh air to hear that you guys do provide ongoing support for practices. Now, what would you say to a practice that says, we don't feel comfortable having someone who doesn't work in the office answering our phones as a virtual assistant?
Yeah. Yeah, I would say why? That would be my
Okay.
first question.
Okay.
Why? What's the limited belief that you have around not having somebody in your office answering the phones? You can have somebody, whether it's stateside or near shore, that speaks beautiful English, that is able to focus on conversion, and that becomes the conversation. Well, what are you really attached to? Well, I don't want to have somebody with an accent answering my phone calls. Okay, but you're also asking for somebody that needs to be bilingual. So what if this individual
Mm,
can be able to speak Spanish? They might have an accent, but they're able to clearly demonstrate that they can carry themselves in an English format and
mm,
provide a complete sentence. What really is the issue? Oh, well, I don't know. I just can't train them. Okay, well, now we're moving on to something else. So now it becomes a training concern. What
mm,
can't you train? Well, I don't know if they can understand everything that I'm telling them to do. This is new. Whatever the case might be, there's always a solution for it.
yeah.
So we always tackle it from the solution. Okay, well, it's just training. We got to train them. Well, I don't have the time to train. Okay, well, we have the time to train. We have trainers. We can get them in right now, right?
Wow. Yeah.
So it's really just a matter of understanding the core belief system, right? So if your limited belief is around, I don't want somebody that doesn't represent my brand the way somebody in the office would, well, then that becomes a part of the talent acquisition approach to hiring the virtual talent to begin with. We're not just posting an ad for a virtual person, say they are based in Argentina. They're not just applying and then we're getting them in there. They're going through the same screening process that any associate dentist, a hygienist, or assistant would go through because they're providing the same level of service and they're interacting with the same patient base. So it really comes back to the why, and then we go deeper and deeper, almost like an onion, right? We got to peel back the layers and figuring out where the stink's coming from.
Right. Yeah. Yeah. So you mentioned, the training process. So you guys actually will do the training for a practice because that is a concern of practices. I've seen that in the group, being mentioned when, a question gets posed where it's like, hey, how do you guys feel about virtual assistants? Or, how do you feel about this? How do you feel about that? So that's kind of why I wanted to ask you that question. Um, and you know, it kind of boils down to like time. Office managers, um, they're task saturated, and so they have a lot on their plate. And I understand, like when I see the person that's commenting and they're saying, "Hey, look, I'm against it, or I don't like it," or and I think there might be a root cause to that, which has to do with like, well, I'm just getting more thrown on my plate.
Yeah,
So one of the ways you guys alleviate more tasks being thrown on an office manager's plate is by offering the training, right?
right.
Okay.
Exactly.
Okay. And now what else in the process that maybe an office manager could be alleviated from, right? Because I've been in charge of like, hey, let's create the ad, let's post the ad, let's reach out. Like, it's so much to do and so little time in a day.
Yeah.
So like what exactly does that exactly look like,
Yeah.
where you're helping
Yeah.
out?
Yeah, when we are looking at bringing on virtual talent into an office, the most important thing is the mindset conversation. One, if you've just been interested in the ability to do it because you want to save some money, that's one area, and that's a very very small area to dabble in. So that's where we start going into the mindset and the conversation. So you really understand the difference and value that virtual talent can bring to your on-site team. It's not in the essence of replacing functions or roles, but it is in the essence of redirecting to focus on what matters. So the most important thing in the practice is the being patient in front of you. So when you're in that position of an office manager or a treatment coordinator, or you're working in the front desk and you may have some trust issues, maybe this isn't the first time the doc has come to you in the morning huddle and said, hey, we're moving to this company and we're getting 7 new people and you're training them all tomorrow,
Yeah.
right? Like
Yeah.
that's a conversation that we've heard before too.
Oh yeah.
And that's scary. And that type of approach can leave a very sour taste in an office manager and team's mouth, right? Because now it's like, well, shoot, now I have even more to do on top of my day to day.
Yeah.
Because as you mentioned, it is very tactical. There's some things that are like the routine tasks that we do on a daily basis. But what a part of that routine can we become freed up to focus on other aspects? Maybe the office manager is ready to grow into more of a executive type of role. Well, there's a mindset shift that needs to take place from manager to leader inside of that construct. So
Mm,
now, if you're looking at expanding numbers and you have an individual that's wanting to expand in growth, well, now we need to shift her or his thought process around, do I really need to be fixated on being the one that knows everything in the practice? What can I do to delegate outward to now a virtual team member? So
mm,
it's really making sure there's alignment. We're not here to reposition you, but we're here to reposition you to do more that's of highest value for you and your team. We know that insurance verification is mundane. We know RCM is very mundane, but people at times find that to be their superpower and their sweet spot. But now we can position that differently. It's no longer you, the person being the person of fulfillment and doing. How are you now training the person that can be supporting you in the process, right? We can now compartmentalize parts of the journey in that patient flow. It's just, where do you want it to be starting and where do you want it to be released? I think as the landscape and workplace continues to evolve, as I mentioned earlier, the town's the shortage. So if you're not leveraging
um,
virtual talent, you're not leveraging yourself at all. So when you start bringing that in, it has to be an alignment conversation. And when we start our exams are with the office manager and the doctor, because we want to make sure that we're in alignment on the very, very
yeah,
beginning stages of that relationship, because we
definitely.
know our point of contact is the OM. It's not going to be the doc. We
Right.
might look
Yeah.
and check in from a reporting perspective, but the OM and the front office team are the ones interacting with us on a daily basis,
Yeah.
right? Whether it's with us directly from a training and support need or directly with their virtual team member that they're leading and directing for, what's of highest consequence or priority for the day.
Yeah. Yeah, you hit it right on the nose. You know, so yeah, the point of contact is usually the office manager. I mean, the dentist is gonna say, "Hey, here's the task. Go get it done." So,
Yeah,
at the end of the day, the dentist is paying the bill, right? But it's like that's one of the biggest things. And I know that because obviously I'm an office manager. So I've dealt with that for so many years where it's like, oh no, not another thing. Oh no, the person is quitting. Oh gosh, I got to start all over, and it's like,
exactly.
it's just so time consuming, man. It's so time consuming. So, all right. I mean, I love what you guys are doing, and it's very unique process. And so, if any of the members in our group would be looking to hire talent by Zia for their services, how can some of the members reach out to you guys? Do you have a website? I assume you do.
Yeah, yeah, you can give us a shout on our website. It is www.talentbyzia.com. You can reach out to our direct email as well, which is hello@talentbyzia, or even give us a follow on all the social platforms. Same handle is the @talentbyzia. We keep it very, very structured, very
Yeah,
clean across the board.
like that.
But that's where you can reach out and give us a shout and kind of see the magic that we're making over in our discussions. And it's a lot of fun. And the one thing that I would have to say is we're not here to challenge or disrupt. We're here to contribute and support. And that's really the lens that we're looking at coming from.
Cool. Cool, man. I love it. I love it. So, Jonathan, I appreciate you taking the time out today to share Talent by Zia and really just help us, understand what you guys are doing over there. And what I'll do for you guys is when this video goes up, I'm going to share the link for your website as well. So I'll put that in the pinned comments section of the video, and we're gonna put this as a Facebook Live. So, if any of our members out there have any questions, Jonathan, you can reach out to Jonathan and check out their website. And yeah, guys, take care, and we'll see you on our next episode. Jonathan, thanks again. Appreciate you taking the time out today.
Thanks, Kyle. Appreciate you guys.
All right, thanks. Bye.